Now, the news that Angelina Jolie has had a double mastectomy has again illustrated the power of celebrity to highlight an issue. In recent years, another condition that's been talked about after celebrities reveal their own experience is bipolar disorder. There are now 3 types of bipolar, detailed in the manual widely regarded as the Bible of psychiatric medicine. The latest edition of that comes out next week. Before we discuss changing views on bipolar, here's someone who's lived with it.
Extreme highs and lows are beyond what anyone could ever normally experience. So the lows, everyone has an idea about what it is to be depressed, but this isn't just feeling miserable, this is being so depressed you can't physically get out of bed, so depressed your speech is slowed, you find it hard to form words or think of words, reading was very difficult, and I was so ill at that point that I'd have delusions. I was so depressed, so I'd maybe see something awful on the news on telly and start to think I was responsible for it in some way. I was to blame. Every person who has the condition will have a different set of symptoms. It's because it's an illness of the mind that affects behaviour, it's as variable as every person, but also there are clearly distinct types of the illness. So I have bipolar 1, where when you're really ill and manic, your behaviour is very extreme. So you do some of the things I talk about. People have delusions, they don't sleep for days and weeks. They think fantastic things, do really odd things, behave in a way that you would classically call mad. But then there are other people with bipolar 2 whose highs are much less moderate and won't come to the attention of medical professionals because they're just feeling on top of the world and being really busy and active.
Robert Westhead, who suffers from bipolar disorder. Well, Darian Leader is the author of a new book called Strictly Bipolar, which challenges the increase in the numbers of people being diagnosed with this.
The limits of bipolar have changed enormously in the last 100 years. It used to be something deemed to affect less than 1% of the population. Now it's expanded exponentially. The threshold of what counts as bipolar has become so low that in some estimates, up to 25% of the population are deemed to suffer from it. What we're losing in this is a proper study of the old category of manic depression, and instead we're focusing much too much on mood fluctuations, which everyone has. All human beings experience changes in mood, and the more that psychiatry focuses on mood swings, it loses the old research.
Well, let's get another view on this, because Daniel Smith is a reader in psychiatry at the University of Glasgow, and he joins me from there. I wonder what you make of this. I don't know if you've read Darian Leader's book, but essentially he thinks that far too many people are being diagnosed as bipolar today.
Yes, I have read Darian's book, and I think to some extent that is an issue that's current. But I think within NHS psychiatry in the UK, it's still the case that most people who are treated for bipolar disorder have what your previous clip showed, which was bipolar 1 disorder, which is a very severe, debilitating, recurrent depressive disorder, interspersed with episodes of mania. So I think in general the awareness of bipolar disorder in recent years has increased, partly because of celebrities like Stephen Fry coming out describing their experiences of the illness. And it is true to say that more and more people are going to their doctor asking if they might have the diagnosis. But I think that in NHS practice in the UK, resources are still very much focused on helping people with the more severe form of the disorder.
I mean, I want to keep this discussion global if we can, because there are people watching right around the world. Essentially, even if people are more aware and celebrities have come out, can that really account for an increase of, first it was 1% of the population that might be bipolar, and now some assessments saying 25%?
Well, I'm afraid I'd like to know where that research for 25% came from, because it's not, as someone who researches bipolar disorder and has done epidemiological studies and knowing about the research from different areas of the world, 25% isn't a figure that I'm familiar with. I think what is happening is that people who are currently being treated for recurrent depressive disorders, when those people are systematically and carefully assessed for features of bipolar disorder, it is true that a proportion of them can be re-diagnosed as having bipolar 2 disorder. But this isn't necessarily overdiagnosis. One argument might be that this is a more accurate capture of how common this disorder actually is. We often hear that it's just 1 in 100 people affected by it, but in effect there's probably about another 1 in 50 people in a conservative estimate.
Yeah, if we broaden the debate beyond bipolar, it is interesting. You know, this journal that's going to come out next week, this manual, which is used by lots of drug companies as well when they manufacture drugs once they're classified in this particular manual. The numbers of mental disorders has crept up and up over the years. So a temper tantrum, which might have just been a temper tantrum, now has a scientific name. Do you think there is a danger of over-medicalising things which might just be, you know, difficult times in our life or just bad behaviour we ought to avoid?
Well, of course I do. I don't think there's any dispute about that. And the manual that's coming out is, I should mention, from the American Psychiatric Association, so pertains mostly to American practice. Unfortunately, it's quite influential around the world and it's used for research purposes, etc. But yeah, I would agree. There's no, I think most British psychiatrists and many psychiatrists around the world would agree that there's no point pathologizing normal reactions to loss, anxiety, difficulties, stress reactions that tend to be self-limiting, that don't necessarily massively interfere with someone's functioning. So yeah, I think most people would agree that multiple diagnoses of normal experiences is very unhelpful. But I don't think that's the real focus of the DSM that's coming out. I think it's a genuine attempt to try and clarify some of the more severe diagnoses that we have.
Thank you. Dr. Daniel Smith, and we'll be discussing this next week on Impact as well.